Hello and welcome to A Healthy State, a series where I talk to doctors and other health professionals about important health topics. I'm Dr. Nelu Simmons and thank you for joining me. Now, just over half the Australian population identify as female. Heart disease, dementia, lung disease and mental health conditions are among the top illnesses in women. On top of this, pregnancy, childbirth and fertility issues are other health risks that women face. In this episode, we will speak about common period problems and some of the key screening tests that women need to consider. To start off our Women's Health episode, we have General Practitioner Dr. Kavina Sivakumaran joining us to speak about a very important topic, periods. Dr. Sivakumaran has an interest in women's health and counsels patients about this almost every day. Thank you so much for joining me today, Dr. Sivakumaran.
Thank you very much, Dr. Nelu, for having me as well. I look forward to discussing the important topic of periods.
And I'm very excited to have you presenting a Malay summary at the end. So for any of our viewers who understand Malay, please stay tuned for that version. So to start off this chat, let's talk about periods. Can you please give us a quick rundown on when periods typically start and what exactly it means to have a period?
Okay, so having periods is a natural and normal progression that happens in a young girl's life. And often when a girl is between the ages of 8 to about 16 is when a period can happen. On average, most young girls have periods about the ages of about 10 to 13. And you have some girls on either side of this spectrum. Period is when a young woman bleeds from her uterus and sheds the layer of the uterus lining, and this leads to period. It happens once every month. Cycles vary between 21 to 35 days, and most young girls bleed anything from 3 days to sometimes 7 days.
Now, I imagine as a general practitioner, you see a lot of patients who have period problems. Can you give us a bit of a rundown on some of the common presentations that you see in your clinic?
Yes, certainly. I do see a lot of young women, and often lots of them have issues with periods. One of the most common complaints I have is when women have irregular periods, especially when in the first year of having a period. And this is quite normal as your body adjusts to the hormones and also the cycle changes. Other things a lot of young women complain of is the premenstrual symptoms. Premenstrual symptoms can occur a couple of days before a young woman has a period. And often women tend to have a lot of cramping, pain in the lower part of the abdomen, in her lower back, and sometimes in her legs. This can sort of build up towards the period and it often stops and settles down after the first 2 days of the period. Some women also have mood changes where they feel quite irritable, upset, sometimes angry, and often some women also have acne or skin changes. They also notice some breast changes where their breast can be a bit more sore and tender. So this is one big complaint a lot of young women have and how to deal with this. Other issues I often encounter is women complaining about heavy periods, where their periods are far too heavy, they bleed quite a lot, and changing tampons or pads on a regular basis. And some women on the other end of the spectrum where their cycles are quite irregular and they don't get them in a timely fashion.
So a huge range of presentations there. If any of our viewers are relating to this, or if they've had issues with their periods, what do you recommend as a GP be their first port of call?
So depending on what the issue is, most of the time, if it's just heavy irregular periods at the start of the cycle and the woman has premenstrual symptoms, I often reassure them and just tell them, look, some symptomatic treatment with your Panadol, Nurofen over the counter, heat packs, maybe having a rest for 1 or 2 days often will resolve these issues. But if women have ongoing issues and ongoing pain and symptoms that's affecting their quality of life or work, then we need to start looking into other causes. So I always advise women, if you have concerns about unusual periods, please take a note of them, write them in a diary, keep a track of your cycles, come and talk to your regular GP about what we can do. We often have lots of treatments we can help you with. Hormonal therapy is one of them, like the contraceptive pill. There's also other options like medications that we can give you to kind of reduce the frequency or even reduce the heaviness of the period. And then there are more advanced options like surgical options, which we would then be getting our gynecology colleagues to come and get involved in your care as well.
Okay, great. So it sounds like First port of call is, making documentation, so whether this is through an app or keeping a little diary like what you mentioned, and then going and seeing your GP.
Correct, yeah.
Fantastic. Now, on the other end of the spectrum, let's chat briefly about menopause. When do menopause symptoms usually start showing up, and what are some of the common symptoms?
Yes, menopause is a very big topic, and I have a lot of women who often are quite distressed about menopause. So menopause tends to be on the other end of the spectrum, as you mentioned. Most women around the ages of mid to late 40s, and some even in early 50s, often turn up noticing their periods are becoming slower, more irregular or erratic. And menopause is defined by no period for 12 months or more. But most women will notice as they get into their 40s, their periods start slowing down, and what used to be a regular period will now become quite irregular, or sometimes can be even more regular. So within 2 to 3 weeks, you're having 1 to 2 cycles. So often say to women, this is a normal part of aging, and it is part of the estrogen levels or the hormone levels actually falling, which results in this.
And the symptoms that we hear about commonly, the hot flushes and the mood changes, is something that you see a lot of?
Yes, very much so. And a lot of ladies are often quite shaken up by these symptoms because they really affect their quality of life. The biggest complaint a lot of ladies mention in menopause is often the sweating, the night sweats that often happens at nighttime that wakes them up. And then as a result, lack of sleep. And then they feel quite grumpy, irritable, and some of them even quite angry. It is also a period when women can feel quite anxious and quite nervous. Some women tend to notice dryness, especially in their hair, their skin, and some notice vaginal dryness, which can then also cause libido issues as well. Women at this particular part of time need to keep a check on their health because their cardiovascular health, especially their heart health, is really important, and bones can also be affected at this time. So it's important to always check in with your local GP to discuss your general health, especially during menopause.
That's a really good message. I guess it may not be as commonly known that apart from the period issues, there are other changes that happen around this time. So thank you for pointing that out. Is there anything that can be done to help with these menopause symptoms, or is this something that women just have to deal with?
Yes, absolutely. There's so much out there to actually help women with this. I'll go through a few simple things that women can do. Really important things are just eating healthily and just keep exercising, ensure that you've got a healthy lifestyle. So cutting back smoking and then minimizing alcohol, having a well-balanced diet is really important. Number 2, simple things like, wearing thin clothing, especially overnight if you're prone to hot flushes, and minimizing thick blankets and so on. So keep a check on your mental health as well. So really important to keep tabs on, those apps like the Mind Spots and calming apps to kind of help you focus on the anxiety issues if these flare up during the menopause symptoms. The other things are medications that your GP can often prescribe. So we have hormonal and non-hormonal options. And the hormonal options are like HRT, which is hormone replacement therapy, to give you a little bit of estrogen and progesterone to help even out those cycles. Some women are not often can't have those sort of medications, and the non-hormonal options are available. I always remind women, though, please always see a doctor about this, and always get checks like your breast checks and pap smears and heart and bone checks as well at this time, because often this can be important when deciding whether you're suitable for HRT treatment.
Oh, some fantastic points there. And you've actually answered my final question, which is who is the best person to speak to? And it sounds like probably a general practitioner.
Yes, I think it's a good starting point. Talk to your GP. Often, they can give you some good direction. And if your GP is unable to help you with those issues, often he or she would send you off to a gynecologist for further, testing and discussion.
Fantastic. Thank you so much. That has been so insightful.
Thank you very much, Nelu.
Now, Dr. Sivakumaran, you have kindly agreed to give us a rundown in Malay for our viewers who speak Malay. Would you be happy to go through some of what we've discussed in Malay for us?
Absolutely. So I'll start my discussion Malay and I'll go through pretty much the same points there. So selamat pagi, nama saya Dr. Kavina Sivakumaran dan pagi ini saya akan berbincang topik haid dan menopause. So haid adalah atau menstruasi adalah permulaan transformasi seorang budak perempuan kepada wanita. Menstruasi biasa bermula bila wanita berumur 8 ke 16 tahun, tetapi puratanya 12 ke 13 tahun. Wanita pada masa ini boleh mengalami haid untuk 2 ke 3 hari, kadang-kadang 3 ke 7 hari dan untuk tempoh 21 ke 35 hari setiap bulan. Ada masalah dengan haid iaitu sindrom paramenstruasi yang boleh berlaku beberapa hari sebelum menstruasi seperti berasa cepat marah, sedih, kecewa, sakit payudara ataupun timbulan jerawat. Inilah masalah-masalah yang biasa dan wanita boleh berjumpa dengan doktor mereka untuk berbincang tentang strategi untuk ubat dan membantu mereka dengan simptom. Masalah lain adalah bila haid yang banyak ataupun haid yang senggugut, ada ubat-ubat atau hormon yang boleh digunakan untuk membantu wanita pada masa ini. Yang penting ingatkan haid adalah kejadian biasa. Semua wanita akan mengalami haid. Tukar tuala kerap dengan kerap dan catatkan tempoh hari haid anda. Kalau ada masalah, jumpakan doktor tempatan anda ataupun pakar ginekologi. Sekarang saya akan berbincang menopause pula. Menopause adalah fenomena di mana wanita tidak mengalami haid untuk 12 bulan atau lebih. Menopause dikenali sebagai putus haid dan ini biasa berlaku kerana hormon estrogen terjatuh. Ini berbeza daripada satu wanita dengan wanita lain. Wanita yang mengalami haid boleh berumur daripada 40 tahun kepada 51 tahun. Purata umur yang biasa untuk wanita mengalami menopause adalah 50 ke 51 tahun. Simptom menopause berbeza daripada wanita tetapi ramai mengalami simptom sensasi panas atau berpeluhan. Biasanya pada waktu malam, cepat marah, faraj yang kering dan gatal, rambut dan kulit yang kering, pendarahan haid akan juga berkurang dan ini juga boleh mengganggu libido. Kadang-kadang wanita boleh mendapatkan haid setiap 2 ke 3 minggu ataupun beberapa bulan. Wanita akan juga merasa emosi berubah, masalah memori dan boleh berasa risau. Wanita digalakkan berjumpa doktor tempatan untuk berbincang ubat yang boleh digunakan. Saya akan memberikan wanita beberapa petua. Nombor 1, amalkan gaya hidup yang sihat, makan diet yang seimbang dan bersenaman. Nombor 2, ada ubat hormon yang boleh digunakan untuk mengurangkan simptom menopause tetapi wanita perlu mengalami pemeriksaan payudara dan juga pap smear atau pemeriksaan cervix pada masa ini. Jumpalah doktor anda juga untuk berbincang kalau ada masalah lain ataupun jumpa pakar ginekologi untuk membincang masalah haid ataupun masalah menopause. Terima kasih.
Thank you so much for joining us today, and I hope our viewers found that a very useful segment. I know I certainly learnt a lot for the years to come.
Thank you so much for having me this morning.
Next up, I will be joined by Dr. Joyce Wu. Dr. Wu is an obstetrician and gynecologist who specialises in women's health issues ranging from pregnancy to periods to prolapse. She is going to speak to us about screening tests that are important for women and some common gynecological issues seen in older women. Dr. Wu, I hear you have just delivered a beautiful baby into this world and now you have jumped online to join us in the studio. Thank you so much.
Thank you for having me.
Okay, so let's talk screening. Now, we know that bowel cancer screening, skin checks, blood tests for cholesterol and diabetes are really important for men and women alike. But there are some screening tests that are offered just for women. Can you please talk us through some of them and tell us why they're important?
Okay, so there are currently a couple of screening programs that all Australian women are free to access. So basically today I want to take the opportunity to discuss cervical cancer screening, breast cancer screening, and a little bit about osteoporosis. So I guess starting with cervical cancer screening. So what used to be called a pap smear test is now called cervical screening test. This is essentially taking some of the cells from the cervix sent to the lab to assess the risk of developing cervical cancer, which can occur to women at all ages from reproductive life. Currently in Australia, the recommendation for cervical screening test is from the age of 25 to the age of 75 every 5 years. This can be done with your general practitioner or family doctor, or can be done by a gynecologist. Quite a few community clinics that are run by midwives or nurses often would have facilities available to perform this for women. It is important that cervical screening test is performed regularly for any women who has been sexually active, because this allows for early detection of cervical cancers, which then leads to early treatment and potentially full cure of the condition. We know that cervical cancers takes a long time to develop, and that's why early detection could potentially improve outcome of women affected by this condition. The next I want to briefly talk about is breast cancer screening. So breast cancer is one of the leading causes of cancers in women. Most breast cancers occur in older women. However, there's more and more young women affected by breast cancer worldwide. The current recommendation for breast cancer screening is in the form of a mammogram, which is a special X-ray for each breast that is recommended for women over the age of 50 to age of 74 at 2-year intervals. This is free to all women at this age group. However, outside of this age group, so women between ages 40 and 49 and women over the age of 75 have free access to mammogram if there's any family history or if there's any specific concern that you would like to access screening to see whether there's any abnormality. It is also very important for women to have an awareness of any abnormal lesions or abnormality that they may feel themselves, and to present to your family doctor if you feel that there's something not right. And again, breast cancer is a condition that we have a lot of knowledge about these days, and certainly early detection by one of these screening programs would allow for full treatment and cure of the disease. Lastly, just a little bit about osteoporosis. So osteoporosis is a condition that is essentially thinning of the bone related to an older age and reduction in women's hormones. Osteoporosis in Australia currently has no specific screening, but any women over the age of 50 with risk factors are encouraged to speak to their GP. The importance in checking for osteoporosis is that thinning of the bone or having weak bone can lead to fractures in the bone. And if this were to occur in an older age group, then that can impact on their quality of life and mobility as well. There are testing available to assess for osteoporosis. There is also lots of treatment available to strengthen the bone, including supplements, exercises, and specific medications that will improve the bone density. So this, I think, is very important for older women to speak to their GP about.
Fantastic. Thank you for going into that, actually, because I think, there's a lot of education around cervical cancer screening and the mammograms, as you mentioned, but we don't really talk that much about osteoporosis. So that's a great message to get across to our viewers. Now, I wanted to move on to other issues in older women. You've touched about things like osteoporosis and cancer screening, but in terms of gynecological issues, I know you're an expert in this field. Can you give us a bit of a rundown of what sort of issues you see in this age group?
Yeah. So as women reach older age, specifically in the postmenopausal age group, some of the common gynecological concerns that I see in clinical practice include, for example, hormonal changes to their mood, sleep, symptoms involving the urinary system, such as incontinence, which is leakage of the urine, things like prolapse, which is essentially part of the vaginal skin coming down to the outside, or feeling the sensation of a lump in the vagina, vaginal dryness, issues surrounding sex drive and libido are common things that we come across in the older age group. Other things such as bleeding that can occur in the postmenopausal period is also something that we see quite commonly. All of these issues should be discussed with your GP if you come across any of these. They're not necessarily indicating something serious in your health, but there's lots of treatments available if you feel that you're troubled by any of these symptoms. So women with any of these with these symptoms are encouraged to come forward to their family doctor to discuss.
So it sounds like turning to the GP is a great first port of call.
Yes, absolutely.
Thank you so much for joining us today and for sharing your expertise. I think that's been really valuable for all the women who have tuned in today.
Thank you for having me.
I'll let you get back to your busy job delivering beautiful babies.
Thank you.
Thank you for watching A Healthy State. I hope you found the information helpful. This episode and the rest of the series is available to stream on CTV+. I'm Dr. Nelu Simmons, and I'll see you next time.